Kinabukasan ng ITRMC, ating matatandaan. Kaya tara, sing-eskwela na! Audio-visual presentation ating makikita.
Our dream Philippines, a nation that is free from corruption, crime-free, where people has access to universal healthcare and education. A Philippines where people live a peaceful, healthy, and prosperous life. Each one of us has to take on the challenge to contribute to building our dream Philippines. However, building our dream Philippines is not a process that happens overnight. It is a shared responsibility from each and every agency, public or private organizations, and other sectors of the community to take on a transformational journey that will lead to the achievement of our vision. Hence, the Ilocos Training and Regional Medical Center embarked on its transformational journey, which started in September 2018. Through the performance governance system, a clear game plan was set for each division, departments, and sections of ITRMC. In August and September 2018, key ITRMC personnel attended the Basic and Advanced Masterclass Bootcamp on the Performance Governance System. These key personnel were later designated as members of the PGS core team in the Office of Strategy Management. In January 2019, ITRMC formally engaged with the Institute for Solidarity in Asia, who is the forerunner of the Performance Governance System, the newly formed PGS core team, who are the architects of this strategy, came up with the basic governance documents, which consists of the strategy map, roadmap, and balance scorecard. This became the basis of all ITRMC's PGS activities to achieve the desired strategic position, which is to position ITRMC as a people-centered multi-specialty hospital and end referral trauma center. In June 27 of 2019, the Ilocos Training and Regional Medical Center, through the leadership of Dr. Eduardo M. Badua III, passed the initiation stage and was awarded a Silver Trailblazer Award during the Public Governance Revalida. The Office of Strategy Management was capacitated last November 2019 by the Institute for Solidarity in Asia. The OSM was taught how to manage the strategy by institutionalizing the culture of conversation, feedback, and recognition. With the capacitation of the OSM, several committees were formed under the OSM to help manage the strategy. These are the Strategy Review Committee, who are in charge of overseeing the conduct of operations reviews, and they act as process coaches for each department or section. The Strategy Communications Committee are in charge of creating and implementing the cascading or communication plan to ensure the strategy is being communicated to all employees. The Scoreboard Management Committee are in charge of monitoring the scoreboards of each department and sections. At the end of 2019, early breakthrough result was achieved through the establishment of a functional trauma center, which was highlighted during the strategy refresh. In the first quarter of 2020, the COVID-19 pandemic struck the whole world. The control of the spread of the virus, the whole Philippines was placed under enhanced community quarantine, starting the mid of March 2020. All OSM activities, which includes the conduct of operations or strategy reviews, were temporarily suspended. With the lowering of the community quarantine status of La Union to MGCQ by the mid of June 2020, all OSM activities were resumed. The operations reviews are conducted through online platforms. Several strategic deliverables were affected due to the pandemic. Hence, a strategy review and refresh was conducted in the year 2020 of December. In refreshing the strategies, the following were considered: impact of the COVID-19 pandemic to our strategies, changes in the context of the organization, which includes the following: the implementation of the Republic Act 11223 or the Universal Healthcare Law, which mandates ITRMC to be a multi-specialty apex hospital. Second, the 5-year developmental plan of the hospital, which aims to establish 8 specialty centers by 2025. Third, increase in bed capacity from 300 to 800 beds through House Bill number 9073, authored by Congressman Pablo C. Ortega of 1st District of La Union, which was later forwarded to the Senate as Senate Bill number 2342 through Honorable Senator Amy R. Marcos. And lastly, the ongoing COVID-19 pandemic. The strategies were recalibrated and new initiatives and timelines were set. Hence, we are presenting to you the ITRMC strategy map and roadmap for 2021 to 2025. Our strategy map is anchored on our mission and our core values, which defines the identity and purpose of the existence of ITRMC. Our mission is to provide a safe, equitable, accessible, responsive, and evidence-based healthcare service for all through competent workforce, appropriate facilities, and community engagement. Our core values are integrity, excellence, compassion, justice, and people-centered. The support processes are important hospital operations that serves as the backbone for the core processes. These are finance, human resource, organizational culture, infrastructure, and equipment and information and communication technology. The finance strategies shall ensure sustaining health financing and efficient and rational use of health resources. Through their finance roadmap, they will be able to come up with strategies to generate adequate funding for the hospital operations and important development programs and projects while protecting our patients from financial risks. The human resource objective is to elevate the human resource to a level of excellence for good governance and efficient public service. This can be achieved through the attainment of a higher prime HRM accreditation. The organizational culture aims to foster a culture of safety and a people-centeredness across levels of whole healthcare. This can be achieved through the initiatives that will intensify safety culture and step-by-step process in institutionalizing a people-centered culture as stated in the Organizational Culture Roadmap. The infrastructure and equipment objective is to expand health services with functional infrastructure and up-to-date equipment. The infrastructure and equipment roadmap shows the initiatives of the hospital operations and patient support services to ensure elevating operational effectiveness as well as implementing innovations to meet stakeholders' requirements in the infrastructure and equipment. Through this, all the infrastructures and equipment needed for the establishment of the 8 specialty centers will be achieved by 2025. The information and communication technology objective is to improve hospital operations through efficient and effective information and communication technology. The ICT roadmap shows the initiatives for full computerization of the hospital in the next 5 years, which will eventually lead to the integration of information systems and improvement of hospital operations. The next layer in our strategy map are the core processes. Core processes provide the services which are part of the mandates of ITRMC, which are delivering health services, training, and research. The first core process is patient care, which aims to provide a responsive multidisciplinary management for patients. This can be achieved through attainment of the initiatives mapped out in the patient care roadmap, which are creation and implementation of people-centered clinical pathways, creation of patient support initiatives and establishments of new specialized services. These initiatives will ensure equity and access to more quality and cost-effective specialized services for all in Ilocos region. The training objective is to capacitate workforce to provide excellent and advanced health services. The training roadmap had set initiatives that will ensure capacitation of employees for the establishment of the specialty centers and honing them to be more people-centered in delivering their services. A special area of the training roadmap is the establishment of ITRMC as Center for Health Systems Development. Through this endeavor, ITRMC shall take the lead in providing trainings for the capacitation of healthcare workers of health facilities within the network. The research objective is to undertake translational researches to improve hospital services and influence public health policies. The research roadmap clearly defines the steps to be undertaken to ensure the hospital will be able to produce translational researches in the next 5 years. The linkage objective is to create a region-wide socially inclusive and resilient health delivery system. The linkage roadmap shows the step-by-step initiatives in the establishment of the healthcare provider network and expansion of primary care provider network through public health and primary care unit. This would result in the integration of network-based initiatives, which will lead to the achievement of our linkage objective, as well as contribute to the attainment of ITRMC's goal to be an apex hospital. With the achievement of all the objectives of the core and support processes, we will be able to achieve the strategic position of ITRMC, which is to position ITRMC as a people-centered multi-specialty apex hospital and trauma center in the region by 2025, which will contribute to the achievement of better health outcomes, responsive health systems, and financial risk protection. All of these are manifestations of the achievement of ITRMC's vision. A people-centered multi-specialty regional center delivering quality health services, training, and research in the Ilocos region by 2025. At present, the Ilocos training is in the compliance stage of the performance governance system, which will culminate in a compliance revalida. All essential elements such as capacitation of the OSM, cascading of strategies to lower units, and the convening of the Multi-Sector Governance Council are all in place. We are all set and ready to move forward to the next stage of the PGS, which is the proficiency stage. The road to achieving all our goals will be long and arduous, but through our commitment, determination, and love of our country, achieving our dream Philippines is within our reach.